Hi, my name is Jay and I make finance videos. So the purpose of today's video is going to be talking about some of the different healthcare systems or structures around the world, how they work, what their benefits and drawbacks are financially and economically, and then looking at what I personally view as one of the most efficient and brilliant ways to provide healthcare in the world. And I think most people might be a little bit surprised, as you can probably see by the board, but it is the Singapore approach, and the way that they have structured their healthcare system is, to be quite honest, just brilliant. It is a wonderful way to provide healthcare in a balanced way, but I'll get more into that later. So looking at the three different overarching categories, and there's a lot of variation in how countries provide healthcare, but these are sort of the overarching themes that you see often. So a privatized system is a system that's really driven by private companies. So in America, if you want to get healthcare, you have to pay for it. It's run by companies, privatized hospitals, the drug companies, and the insurers. So it is very much driven by if you have money or if you have coverage, you can get healthcare. If not, you're in bad shape. The Canadian or public approach is when you have universal healthcare. So what happens is you pay taxes, the government takes a portion of those taxes and puts it towards building hospitals, paying for doctors, paying for equipment, and so you have quote unquote free healthcare. So when you need healthcare and go to a hospital, it is free, but it's free because you have paid taxes before that have made that possible. That is a public system. And the Singapore approach is both a public and a privatized system working in conjunction. And again, they've structured it in a very interesting and efficient way, but I'm going to get into that when I talk about the benefits and drawbacks. So we're going to start with the American system. And to be quite honest, the American healthcare system is pretty dysfunctional right off the bat. But I am trying to be a more optimistic person, so we'll start with the benefits of the system. So when you have a privatized system, one of the biggest benefits of that is there's a lot of money in there. When you think of having privatized companies that are operating these systems, they can make a lot of money if they create the newest drug that cures whatever, the newest procedure that fixes whatever medical issue is around. And so there's a lot of innovation when you have the American system because there's so much private money that's going into it to find these new medical developments, because you make a lot of money when you do find those developments in the States. And this is actually great for everyone. This benefits the United States and this benefits the world as well, because America is one of the countries that is on the cutting edge of medical development, creating new drugs that solve issues and all of these things, because the companies are desperately trying to make a lot of money. When they find these cures, they get really wealthy in America. And so that is a benefit that helps everybody. Another significant benefit of the American system is you have very low wait times. As long as you have money or you have insurance coverage when you need that medical procedure, you can get that pretty quick, typically. And that is actually a pretty significant benefit. Again, if you don't have the money, you're kind of screwed, but that is an unfortunate reality of a privatized system. And the third significant benefit is because it is a corporate-driven system that is based around money, you have some of the best hospitals and some of the best procedures and medical practitioners in the world in the United States. So again, if you're wealthy, you can get some of the best medical people providing that sort of coverage and those procedures. If you're not wealthy, if you're middle to low income, the United States approach is not as great for you. And that's sort of what really highlights the American system. If you're wealthy, it's great. If you're not, not so much. The drawbacks of the American system, there are a lot of them, but I'm going to focus on 3 in today's video just to sort of give you an idea of some of the dysfunctionality of it. First issue with the American system is, I sort of highlighted on before, most people require insurance to cover their future medical costs. So they get insurance, and then when problems do arise, they at least have coverage to provide for those expenses, which can be quite high in the United States. The problem with insurance in America is they have this strange rule where insurance companies can only operate in one state and they cannot cross state lines. What does that mean? Well, America is broken into a number of different states, so different regions, and when you have basically one insurance company can work in one region, but they cannot go to different other regions. It is a very strange, and frankly, I have no idea why they implemented this in the first place. I can't see a rational reason for it, but effectively it means there's a lot of regional monopolies. where you only have a few insurance companies or operators operating in one area, and they can't spread out. They can't go to different areas. And this is bad for consumers. If you're at all familiar with economics, monopolies are bad because when there's very little competition, companies can start to dictate prices. They can say, we're going to charge this much, and because there's so little competition, you have so few choices, we can do that, and you're still going to have to buy from us. That's a big problem. It means insurance prices can get expensive. It means the coverage is going to get worse because they can say, well, we're not going to cover this. You don't have any other options, so you're going to go with us anyways. That's a problem. Second major issue with the United States approach is because you have a privatized system, drug prices, medical equipment, all of these things are incredibly expensive. What happens when a drug company creates a new medicine that cures whatever, they have a patent on that. That means they have the right to be the person who produces and sells that. They have the sole right to that. So that creates a monopoly in and of itself. Already mentioned before, monopolies are bad. Well, monopolies on drugs are really bad because if you need that drug, well, you're going to pay whatever you need to get that drug. And in the American system, there is nobody that regulates that. The government doesn't step in and say, or they very rarely step in and say, you have to charge a reasonable amount for that. It is more or less dictated by the company itself, and that's very bad. And that is why you have a very expensive system in America, and why almost everyone is forced to get insurance unless you're ultra wealthy. And a third major issue that sort of popped up recently has to do with Obamacare. Now, Obamacare is a fairly controversial bill, and it actually is a very expansive bill. But I'm talking about one single aspect of it that is very strange, and it's the idea that you can get coverage regardless of pre-existing conditions. What does that mean? Well, I'll use an example, actually. So let's say I'm an American, and I have diabetes, I have a heart condition, and I'm overweight. Realistically, almost everywhere around the world, I would not be able to get insurance because I'm a high-risk individual, high risk of getting other diseases, high risk of having to go to the hospital and costing money, and high risk of dying as well. So it would be very difficult for me to get coverage. Well, with the sort of new initiative introduced by Obamacare, I can still get coverage. I can go to an insurance company and say, you have to give me insurance. That's a huge issue because that's not how insurance is supposed to work. If say you're trying to go get fire insurance for your home and you've had 5 fires in the past 2 years, an insurance company will not cover you. Why? Because you're a huge risk. Same thing goes with healthcare costs. It is supposed to be that you get insurance before the health problems arise so that you're covered for when they do happen. But this new system with Obamacare, you can get insurance after the problems arise. And that is a very problematic thing because it means insurance premiums for everyone has gone up. Because all of these people with problems are now getting insurance and they're costing the insurance companies more money, the insurance companies are raising premiums for each and every single individual. And that includes healthy people, people who don't have problems, people who just want insurance for future problems. They're getting insurance the way you're supposed to get it, before things happen. And it's really jacked up the prices of insurance premiums in the United States, and it's a very dysfunctional thing and approach to it. Now, you can make a social argument that everyone should have access to healthcare, and this is a way to provide it. But realistically, if that is your case, you should just be going with a public system and have it paid through your taxes. The approach of forcing insurers to cover people that are already sick or already have health problems, that is a really backwards and strange and dysfunctional way to approach healthcare in the United States. So they have a lot of problems. Those are the 3 ones that I'm going to highlight in this video, but there are more for sure. The Canadian approach. Well, pretty obvious benefit right off the bat. When you have free healthcare, when you have that peace of mind that when things happen to you, you are covered, that is a brilliant thing. And being someone who lives in Canada, I can say it's pretty awesome. And I would much rather have the Canadian system than the American system. It's great not having to worry about healthcare costs. That is a huge stress relief that if you live in a place with a privatized system can be really draining on you mentally. A second major benefit of a public system is that you have a single payer. So in the United States, when you're sort of referencing those monopolies of drugs and things like that that companies own. So when you go to a drug company and say, well, I need to buy this drug to help with whatever medical condition I have, the drug company can say, we're going to charge $50 for this pill. Now, you could go and say, well, actually, that's a lot of money. I'll pay you $5 instead. That's a reasonable amount. The drug company goes, huh, we don't care what you think. We have a monopoly. We're going to charge $50. You can take it or leave it. And because you have that medical condition, you're almost forced to pay that amount. Well, in the Canadian system, when a drug company tries to go, we're going to charge $50 per pill. Well, the Canadian government goes, and because they're the ones that pay for these medical sort of costs, they say, well, no, we're going to pay $5. And this time, instead of being one person against the drug company, it's the Canadian government, which represents 36 million odd Canadians. And the drug company goes, okay, yeah, okay, fine, we'll pay that $5, that's reasonable. When you have a single payer who is negotiating with such a massive sort of body of individuals behind it, the entire population of Canada, you have a lot more sway when it comes to those negotiations than the single American trying to deal with Big Pharma. That is a huge advantage that lowers costs of various drugs and procedures, and it's a huge benefit and a huge advantage over the American system. Now, two really great things about the public system, but there are some drawbacks, and there's one very, very significant drawback, and that's that people abuse the system. When you have free healthcare, whenever you need it, people start to use the system for things that they don't really need to go in for. People get a little bit sick, they have a cold, they go in the hospital. What's the drawback of not going to the hospital? It doesn't cost you anything. So all of these people that, if you think of an American, they're probably not going to go in if they get the common cold. But in Canada, there's no drawback to it. So people start to abuse the system. They start to take advantage. They go in for everything, whether they are really sick or they're not. And that gums up the system. It creates these massive waiting lines for various things. When you think of the United States, it might take you, say, a week for a generic procedure like an MRI. In Canada, it might take you 9 months. It might take you a year. There are these massive wait lines because there are these people abusing the system and sort of gumming up these waiting lines that are adding sort of all this time to get the procedures you need. And that is a massive problem with the public system because there's no easy answer. When you have free access to healthcare, when there's no downside for going into a hospital, people start to abuse it. And that is a significant issue that doesn't have a really easy answer to it. Another problem with the Canadian system, it does get kind of expensive, where the government is paying for everything through taxes. It does add up over time. But again, it's a pretty good system. Definitely an improvement, in my opinion, of the American system. But now we're going to get to the Singapore approach. And as I mentioned before, they have done a brilliant job of structuring a medical system. And there's a lot of different parts to it, so I'm going to sort of go through it one by one to explain each one. On their public side, the first and foremost thing that Singapore has done is they have nationalized their insurance companies. What does that mean? The insurance companies are run by the government, and so they charge reasonable rates for insurance coverage comparatively to the United States. So you can get reasonable costing insurance. Now, you can't have pre-existing conditions, it's not dysfunctional like America, but it is a reasonable cost. And they provide subsidies for people who are low income, who don't necessarily have enough money for that coverage. Second major thing, they have mandatory savings for healthcare costs. So if you live in the United States, Canada, and various other places around the world, you're probably familiar with retirement programs and accounts that either mandatory savings or encourage you to save for retirement. It's a very similar thing in Singapore, except it's for healthcare costs. And so everyone, when they make money, is mandated to put a certain amount of that towards a savings account, MediSave, and then they can use that for future healthcare costs. Those accounts are actually pooled in their family, and there's a lot of different ways you can use it, but essentially it's forced savings to make you prepare for future medical costs and issues that might arise. Now, the public system, you still have to pay for it in Singapore to a certain degree, but a big benefit of their approach is the Singapore government gets in and negotiates reasonable prices. So they regulate drug prices, they regulate medical procedure costs, so they're a reasonable rate. That's sort of that same single payer benefit. The government is negotiating on your behalf so things are reasonably costing. You still have to pay for them, but they're reasonable. And you have reasonably costing insurance, And so it is a huge benefit, and it means it's a very low cost and efficient system. And because you're still paying for it, because you still have to pay when you go in for procedures, there's less abuse of the system. Because you're not going to go in for the common cold if you have to pay to see the doctor. You might wait, and if it gets worse, fine, you go in and you make that sort of payment. But it is a very easy way to reduce some of the massive waiting line issues you see in Canada. And another major benefit of the Singapore approach is they have a privatized system in conjunction with their public system, meaning that if you're wealthy, you can skip the waiting lines. You can pay more to get ahead. And what that does is it provides funding to the system, it provides funding to the healthcare system, while reducing the wait times for everybody else. And it is a very smart way to actually go about healthcare. It's a very balanced approach that sort of takes the benefits of both the Canadian and American way, the public and private sector, and sort of gets all of the benefits with more or less none of the drawbacks. Realistically, there aren't really many significant issues with their system. It probably can be improved moving forward in the future, but I would safely say this is probably the best healthcare system in the world at this point, and it really is structured in a brilliant way that makes healthcare efficient, cost-effective, and just great, frankly. And I personally don't see any obvious ways for it to be improved, and there aren't significant drawbacks other than potentially the fact that you could argue that the ultra-poor still can't access healthcare, people that even can't afford the insurance with the subsidies, but that's a problem in many systems regardless. So they're doing real great, and they have a very efficient and fantastic system, frankly. Now, talking a little bit about how some of these other systems can be improved, America, as I mentioned before, has a ton of problems, but there are some actually pretty easy ways to go about fixing those, or at least start fixing them. The first one is obviously open up those state lines so that insurers can operate wherever they want. And again, I have no idea why they haven't done this yet. It's probably some politics BS, some backroom deals that has sort of resulted and continued in this fashion. But by opening up competition among insurers, that lowers premium costs, that will improve coverage, and it just benefits everybody. There really, again, I see no rational reason why that would not be done. Second major thing, the government needs to step in and start negotiating these drug prices. They need to start representing the American people. Instead of having the one American go and negotiate for drug prices, they're not going to win. They can't deal with big pharma. Have the government go in and say, you are charging unreasonable amounts for this drug that people need. This is a reasonable amount where you still make money, but it is affordable for most individuals. They need to do that. That needs to be done. It probably won't happen because there's a lot of money that goes through campaign contributions in the United States from Big Pharma, and it's probably why it hasn't happened yet, and it won't happen moving forward, most likely, but that would be probably the best thing for their system to make it more affordable for everybody else. That would then also lower insurance premiums because everything costs less. All around, it would just be great, pretty much. Canadian system, the big major thing that they can do is introduce a privatized system alongside the public system, meaning that you can pay to jump the lines. It's kind of like a fast pass if you've ever been to an amusement park. So a wealthy Canadian could go in and say, you know what, I'm going to pay, say, $5,000 to skip the lines to get this MRI. And something I really want to highlight with this, because I'm sure some people are thinking this already, I'm not talking about paying to, say, get organ transplants, where this 90-year-old individual is paying $1 million to get the heart that a 16-year-old needed to survive. That's not what I'm saying. I'm saying for everyday procedures, things like MRIs and basic medical things where they can pay to skip the lines. It's not life-threatening. It's not like they're taking something from somebody else. What that does, it reduces the waiting time for everybody else because the wealthy individual is moved from the queue that other people would be in, and the money that they're putting towards paying for that, for skipping the line, that can be used to actually fund the system so that they can buy more doctors, more hospitals, and provide more efficient and faster healthcare. So not only does it reduce the wait times because they're no longer in the line, it also provides funding to speed up the time that people are waiting for. And it is a pretty easy way to do it. Unfortunately, much like the American system, it's actually probably very difficult to implement that because when you say that someone can pay to skip the lines, it almost is a bad connotation for most people when they think about that, because they don't look beyond that and say, well, actually it benefits me a lot if they pay to skip the line. But they just immediately think of some rich individual that is sort of greedily moving ahead of them, and they feel bad about that. But realistically, it actually would be a great thing for everybody if that happened. As I mentioned before, I don't see any significant issues with the Singapore approach. I personally don't see any significant ways it can be improved. It is a very brilliant and efficient system, and they're doing a fantastic job, and I think the world could definitely learn from the way that they are structuring their healthcare. As always, if you like the video, very much appreciate a like, share, and subscribe. It helps me grow the channel. And if you have any suggestions for content or subjects that you would like me to discuss, feel free to leave them in the comments below. I'm always curious to see what people want me to talk about. And as always, have a great day.